Welcome to Gout Gourmet, the deep dive dedicated to helping you navigate the world of gout, cutting through the noise to find the clearest path forward.
We're here to take the latest understanding in research and really synthesize it for you so you feel informed, empowered, and, ready to take control.
That's exactly right. And this week, we're zeroing in on a topic that brings, well, significant challenges to millions. The pain, the limited movement, the daily struggle that gout can impose.
Our focus today is squarely on taking control of gout in 2025. We're looking at how you can move definitively away from those unpredictable, excruciating flares and build a life that's centered on pain-free living and, crucially, improved mobility.
This is so much more than just a medical condition. It affects your ability to work, to enjoy time with family, just to move freely. And we know it impacts not just the person living with gout, but also their caregivers. And there's this persistent myth out there that managing gout means resigning yourself to a diet of just bland, tasteless food.
Oh, definitely. We really want to bust that myth wide open today.
And show you that's absolutely not the case.
Our mission in this deep dive is to extract the most important, actionable insights, the true nuggets of knowledge from the current understanding of gout.
We want to provide you with practical strategies, help you truly grasp what's happening in your body, offer concrete tips for managing pain and mobility challenges, provide insight for those supporting someone with gout, and ultimately show you that effective management, including diet, can absolutely be vibrant and livable.
Okay, let's unpack this then. Let's start right at the beginning. At its core, what is gout really all about?
That's the fundamental question, isn't it? Gout isn't just bad joint pain.
No, it's actually the most common form of inflammatory arthritis. And the scale is significant. We're talking about over 9 million people in the United States alone affected by this condition.
That's a huge number.
Right.
So what's the underlying process happening inside the body that causes all this trouble?
Well, the root cause is persistently high levels of uric acid in the blood. This condition has a medical name, hyperuricemia.
Hyperuricemia.
Uric acid is a natural waste product. But when your body either produces too much or, more commonly, your kidneys don't excrete enough, it builds up.
Right.
And when those levels get too high, uric acid can form these sharp, needle-like crystals.
Needle-like crystals. Just hearing that sounds incredibly painful.
It is. These crystals deposit in your joints and sometimes in surrounding tissues. And it's these crystal deposits that trigger an intense inflammatory response, leading to what many people describe as a feeling like their joint is literally on fire. It's sudden, severe pain, often debilitating.
So the agony during a flare isn't just general inflammation, it's these physical, sharp crystals irritating the joint.
Exactly. They're like microscopic shards of glass inside your joint capsule. While gout can affect any joint, there's one location that's really iconic, almost synonymous with the condition.
The big toe.
The big toe, exactly. The joint at the base of the big toe. When gout strikes there, it's called podagra, and it accounts for a significant majority of first attacks.
Is everyone equally susceptible, or are there patterns in who tends to get gout?
Oh, there are definitely clear demographic patterns. Men are significantly more likely to develop gout than women, about 3 times more likely.
3 times.
Wow.
Yeah.
For men, symptoms typically begin between the ages of 30 and 50. For women, it usually starts later in life, often after menopause.
Okay.
And it's also critical to understand, and this is a point that really can't be stressed enough, that without appropriate, consistent treatment to lower uric acid levels, gout is not just a series of painful but isolated attacks. It's a progressive disease that can, over time, cause permanent, irreversible joint damage.
And that really highlights the urgent need for effective long-term management.
Absolutely. That progression and the risk of permanent damage really drive home why understanding and treating gout is so vital.
You mentioned it's progressive. It often follows a path or different stages. Walking through those stages seems important for understanding the journey.
It really is. Understanding the typical stages helps you recognize where you might be in your experience with gout and, what could potentially happen if the condition isn't managed effectively.
Makes sense.
It also strongly underscores why current research and updated 2025 guidelines are placing such a heavy emphasis on early intervention. The goal is to prevent the disease from ever reaching those more advanced, debilitating stages.
Okay, so what does that initial stage look like before the first painful flare?
That's stage 1. Asymptomatic hyperuricemia.
Okay.
This is often referred to as the silent stage. In this phase, you have elevated uric acid levels in your blood higher than the target goals we aim for, but you haven't experienced any symptoms yet. No pain, no swelling, nothing physically noticeable.
So the underlying problem is there. The uric acid is building up, but the body hasn't reacted yet.
Precisely. Think of it like high blood pressure before it causes any symptoms. Normal, healthy uric acid levels are generally considered to be below 6 milli-GDL for women and below 7 milli-GDL for men. In the asymptomatic stage, you're above these levels, and crystals might even be starting to form silently in some joints, but they haven't triggered that inflammatory attack yet.
And this stage can last for years, you said.
Yes, sometimes even decades.
Wow. And then, one day, often without warning.
Exactly. That brings us to stage 2, the acute gout attack. This is the point where most people first realize something is seriously wrong. It's the first painful flare.
The wake-up call.
Definitely. Characterized by the sudden onset of severe pain, redness, swelling, and heat in an affected joint. As we mentioned, the big toe is the most common initial site, often striking overnight.
That's the on-fire feeling you described.
Yes, that's the classic description. The pain is incredibly intense. People often say that even the slightest pressure, like the weight of a bedsheet, is excruciatingly painful.
Ugh.
Without treatment to stop the attack, these flares can last anywhere from a few days, typically 3 up to 14 days, sometimes even longer. It's a period of significant disability and suffering.
And what happens after the attack subsides? Does everything just go back to normal?
For a while, yes. That's stage 3, intercritical gout. These are the periods between acute attacks where you are symptom-free.
The quiet times.
Right. You might feel completely fine, no pain or swelling. These symptom-free intervals can initially last for weeks, months, or even several years. However, and this is a crucial point, often misunderstood even though you feel fine, the underlying issue
The high uric acid.
is still present. Exactly. The uric acid continues to build up silently in your body, potentially forming more crystals.
So the risk is still there, and the silent buildup continues.
Absolutely. And without treatment to lower the uric acid consistently, those intercritical periods tend to get shorter over time. The flares become more frequent, potentially affecting more joints.
Not good.
No. And this silent ongoing buildup, often over a decade or more without proper treatment, can lead to the most advanced stage. Stage 4, chronic tophaceous gout. This stage typically develops after 10 or more years of living with gout without effective long-term management. By this point, those uric acid crystals have accumulated into larger, visible deposits called tophi.
Tophi. And what are these like? Can you actually see them?
Yes, you can. Tophi are noticeable lumps or nodules under the skin. They most commonly form around the affected joints, but they can also appear on the ears, elbows, fingers, or even around the ankles.
So they're visible signs of the crystal buildup?
Correct. And importantly, in this chronic stage, the ongoing crystal deposition and inflammation cause significant irreversible joint damage and deformity. This leads to constant chronic pain, not just during flares.
Oh, wow.
And results in severely limited mobility, making even simple daily tasks extremely difficult. This stage is really what highlights the importance of preventing progression through early, consistent treatment.
Understanding those stages really paints a clear and, frankly, pretty scary picture of the potential path if gout isn't managed. It moves from silent to occasional agony to constant pain and disability. Given that, how does someone recognize when they're experiencing an acute gout attack and when it's time to get help? What are those classic warning signs you absolutely shouldn't ignore?
The hallmark signs are quite distinct. First, that sudden, intense joint pain, often starting very abruptly, frequently waking people up at night.
Okay.
The affected joint will typically be red, hot to the touch, and noticeably swollen.
And that extreme tenderness you mentioned earlier, like the bedsheet thing.
Yes, the extreme tenderness is a key indicator. The pain is often so severe that any pressure, even the weight of bedding or a light touch, is agonizing. That level of sensitivity is quite characteristic of a gout flare.
Right.
Additionally, you'll often experience limited range of motion in the joint. The pain and swelling make it difficult or impossible to move the joint through its normal range.
Which directly impacts mobility.
Exactly, especially if it's a weight-bearing joint like the ankle or foot. Simple walking can become impossible.
Those symptoms sound unmistakable and truly disruptive. When do these symptoms warrant immediate medical attention? Are there particular red flags that mean you should seek urgent care?
Yes, absolutely. While many gout attacks follow a typical pattern, there are situations where you need to see a doctor right away. If this is your very first suspected gout attack, it's crucial to get a proper diagnosis.
Why is that so important?
Because gout can mimic other conditions, like a joint infection, which requires different and very urgent treatment. so a first attack needs evaluation.
Okay.
Also, if the joint inflammation is accompanied by a fever, that's a significant red flag. It could indicate a joint infection, which is a medical emergency.
Fever plus joint pain. Got it.
Also, if multiple joints are affected simultaneously, or if your symptoms are unusually severe or lasting longer than, say, 10 days without any signs of improvement, you should also seek prompt medical evaluation. These situations require timely diagnosis and management by a healthcare professional.
That's really practical guidance, knowing when to manage at home versus when to head to the doctor or urgent care. Now, let's shift gears and talk about the modern approach to treatment in 2025. The information we're looking at really emphasizes medication as the absolute foundation.
That's the key shift in the modern approach, particularly highlighted in updated 2025 guidelines. Treatment has moved beyond just reacting to flares.
Right, putting out fires.
Exactly. To proactively preventing them by addressing the underlying high uric acid. This involves early, consistent, and often quite aggressive intervention to lower uric acid levels long term.
And this is where urate-lowering therapy, or ULT, comes in.
Exactly. ULT is the cornerstone of long-term gout management. Its primary purpose is to lower the total pool of uric acid in your body and keep it low consistently.
So it actually gets rid of the crystals.
Over time, yes. It dissolves the existing uric acid crystals and prevents new ones from forming, ultimately stopping the flares and preventing that long-term joint damage.
What's the main medication used for ULT? The first one doctors usually try.
Allopurinol is considered the first-line treatment for most people. It's often referred to as the gold standard because of its long history of use, effectiveness, and general tolerability for many patients.
How does it actually work?
It works by blocking an enzyme in your body called xanthine oxidase. This enzyme is necessary for the body to produce uric acid from purines.
Ah, okay.
By inhibiting it, allopurinol effectively reduces the amount of uric acid your body makes.
So it's not just flushing it out, it's reducing the source.
Precisely. It tackles the production side of the equation. The typical starting dose is usually 100 milligrams daily. However, if you have kidney disease, the starting dose is often lower, maybe around 50 milligrams, because kidney function significantly impacts how the drug is cleared.
Right.
But what's critical is that the starting dose is just that, a start. The dose needs to be adjusted upward over time based on your uric acid blood levels until you reach a specific target.
What is that target? What number are we aiming for?
The universally accepted target for effective gout management is to maintain your serum uric acid level consistently below 6 mg/L.
Below 6, okay.
And for individuals with more severe gout, like those who have developed tophi, the target is even lower, aiming for below 5 mg/L.
Below 5 for severe cases?
Yes. Reaching and staying at this target is paramount because studies show this is the level at which uric acid crystals actually begin to dissolve. Monitoring your uric acid levels regularly is essential to ensure you're on track to reach this goal and then stay there long term. It's a treat-to-target strategy.
Does hitting that target mean you're instantly flare-free? Like the day your blood test shows 5.9, you're good?
Not necessarily instantly, no.
Yeah.
While lowering uric acid is a long-term solution, it can take time for those existing crystals to dissolve. The full benefits of being at the target level, meaning a significant reduction or elimination of flares, and the shrinking or dissolution of tophi, may take 6 months or even longer of consistent therapy.
Okay, so patience is key there. Now, there's a really crucial 2025 update you mentioned regarding ULT and flares that feels counterintuitive to what some people might have been told in the past. What is that?
This is perhaps one of the most significant recent shifts in gout management guidelines. In the past, it was common practice to advise patients to stop taking their urate-lowering therapy, like allopurinol, when they had an acute gout flare.
Right, I've heard that. Stop it until the flare is gone.
Exactly, and only restart it after the attack subsided. The updated 2025 guidelines emphatically state the opposite. You should continue taking your urate-lowering therapy without interruption, even when you're experiencing an acute gout flare.
Really? Keep taking it even when you're in agony. Why is it so important not to stop it?
Stopping and then restarting ULT can cause fluctuations in your serum uric acid levels. These rapid changes, even a temporary increase or decrease, can actually prolong the current flare or even trigger another flare soon after you restart the medication.
Ah, so it makes things worse potentially.
It can. Continuing your ULT consistently maintains stable drug levels and keeps you on the path toward dissolving those problematic crystals and achieving long-term uric acid control. You do this even while you're simultaneously treating the acute pain and inflammation of the flare with other medications. It's about keeping your eye on the long game.
Okay, so that's a really key takeaway. Keep taking your regular gout medication even when you're in the middle of a painful attack. What about preventing flares, specifically when you first start ULT? It sounds like sometimes starting it can initially stir things up.
That's absolutely correct. When you first start ULT, as uric acid levels begin to drop, it can sometimes mobilize existing crystals, paradoxically triggering a flare.
Oh, great. So you start treatment and get a flare.
It can happen. But to counteract this, healthcare providers typically prescribe a flare prevention protocol alongside the initiation of ULT. This usually involves taking a low-dose anti-inflammatory medication for a period of time to suppress this potential flare risk.
What medication is typically used for that prevention?
Low-dose colchicine, usually 0.6 milligram taken daily, is the most commonly prescribed medication for flare prophylaxis during ULT initiation.
Colchicine. Okay.
This preventive therapy is generally continued for a minimum of 6 months, giving your body time to adjust to the lower uric acid levels and stabilize. If colchicine isn't tolerated or is contraindicated, alternative options like low-dose NSAIDs or corticosteroids might be used for this initial preventive period.
So the modern standard approach is start ULT, add prophylaxis like low-dose colchicine to prevent initial flares, and keep the ULT going even if a flare happens anyway.
That's the current best practice in a nutshell.
Beyond starting ULT during attacks, what are some of the other revolutionary changes or points of emphasis in the 2025 guidelines?
Well, one of the major shifts, as we touched on, is the rigorous treat-to-target approach becoming the standard of care.
Yeah.
It's no longer considered adequate simply to prescribe a dose of ULT and, hope it works.
Right.
Regular monitoring of uric acid levels and adjusting the ULT dose until the target of below 6 mg/dL or 5 mg/dL for severe cases is consistently achieved and maintained is now the expectation. This proactive dose adjustment based on blood work is crucial for ensuring effective crystal dissolution and long-term prevention of joint damage.
So it's about reaching that specific number and staying there, not just feeling better.
Exactly. That number is the clinical goal because it's what's supported by evidence for truly controlling the disease at its source. Another emphasized update is the importance of personalized dosing based on kidney function.
We mentioned that with allopurinol starting doses.
Yes. Because the kidneys are so involved in clearing uric acid, understanding and accounting for an individual's kidney health is vital for both the safety and effectiveness of ULT medications.
Any other interesting potential connections or future directions highlighted?
Yes, one fascinating area receiving attention, particularly for patients with multiple health conditions, is the potential role of SGLT2 inhibitors.
SGLT2 inhibitors, what are those?
These are medications primarily used to treat type 2 diabetes and also reduce the risk of heart failure or kidney disease progression in certain patients.
Okay, so diabetes and heart-kidney drugs.
Right. But emerging evidence suggests that these medications may also have a beneficial side effect of lowering uric acid levels.
Oh, interesting.
Offering a potential dual or even triple benefit for patients who have diabetes, kidney issues, and gout. It's an interesting area where treatment for one condition might help another.
That's a great example of how understanding connections between different body systems can lead to more holistic treatment. Let's delve a bit deeper into the specific medications we've mentioned, starting with allopurinol again.
Certainly. Allopurinol, the primary ULT, as we discussed, blocks xanthine oxidase to reduce uric acid production. Starting dose often 100 milligrams, adjusted based on kidney function lower if kidney disease is present, and then titrated based on monthly uric acid level monitoring until the target is reached.
And what about key safety points for someone starting allopurinol, things to watch out for?
The most important safety alert is the potential for a rare but serious skin reaction. If you develop any kind of skin rash while taking allopurinol, you should stop the medication immediately and contact your doctor. That's critical.
Any rash, stop and call. Got it.
Calming side effects are generally less severe, like mild stomach upset or perhaps some drowsiness. Because allopurinol can interact with certain other medications, it's absolutely vital to inform all your healthcare providers, your primary doctor, specialists, even your dentist or pharmacist, that you are taking it.
Good tip.
And taking it after meals can sometimes help minimize stomach upset.
What if someone can't take allopurinol due to side effects or interactions? Are there alternatives for ULT?
Yes, febuxostat, sold under the brand name Uloric, is another effective urate-lowering therapy. It works via the same mechanism as allopurinol inhibiting xanthine oxidase, but has a different chemical structure.
So it's another option if allopurinol doesn't work out.
Exactly. It's typically considered an alternative for patients who don't tolerate allopurinol or for whom allopurinol is contraindicated. Febuxostat can sometimes be a preferable option for individuals with certain degrees of kidney impairment, although it is generally a more expensive medication than allopurinol.
And colchicine, you mentioned it for preventing flares when starting ULT at that low dose. Is that its only use?
While its primary use in modern management is for prophylaxis during ULT initiation at that low dose of zero point 0.6 milligrams daily, colchicine is also a very effective medication for treating an acute gout flare.
Okay, so it works for flares too.
Yes, but for treating a flare, timeliness is crucial. It's most effective when taken at the very first sign of symptoms, ideally within the first 12 hours. It acts by interfering with the inflammatory response triggered by the crystals.
Within 12 hours. That's fast.
It is. Like any medication, it has potential side effects. The most common is diarrhea. It's also important to be aware of potential drug interactions with colchicine, particularly with certain antibiotics and cholesterol medications.
So, low-dose colchicine for prevention alongside ULT, and potentially higher dose, following specific prescribing guidelines, of course, for an acute flare if caught early. It sounds like there are multiple tools in the toolbox. Are there options for the most difficult treatment-resistant cases?
Yes, thankfully. For individuals with severe gout that hasn't responded adequately to standard therapies like allopurinol or febuxostat, there are more advanced options. Pegloticase is an example. It's a unique medication given intravenously that directly breaks down uric acid.
IV medication. Okay.
Combinations of medications, sometimes including agents like lesinurad, which helps the kidneys excrete more uric acid, are also used in complex cases, often under the care of a specialist.
So specialist care for complex cases.
Right. And there's also fascinating, though still emerging, research looking into areas like the gut microbiome and how probiotic therapy might potentially influence uric acid metabolism in the future.
That's really interesting. Gut health affecting gout?
It's an area to watch.
It's reassuring to know there are escalating options if standard treatment isn't sufficient, and that research continues. Okay, medication is clearly foundational, but for many people, diet is the first thing they think of with gout. And the common assumption is that a gout diet means eating nothing but incredibly restrictive, bland, and boring food. Is that the reality in 2025?
That is absolutely a major misconception and one we really want to dispel. While it's true that certain foods are high in compounds called
Purines, right.
which the body converts to uric acid, and these need to be limited or avoided, the vast majority of healthy, delicious foods are completely gout-friendly. A gout-friendly diet is far from bland. It can be vibrant and satisfying.
That's good to hear.
And this is important to emphasize. While diet is a critical support for managing uric acid, it typically cannot replace medication for achieving and maintaining the necessary low uric acid levels for long-term control in most cases.
Ah, okay. So diet helps, but it's not usually the whole solution.
Exactly, especially if you have moderate to severe hyperuricemia or existing tophi. Medication does the heavy lifting for dissolving crystals and preventing future damage.
So diet is an essential co-pilot, but usually not the captain.
That's a great way to put it. It helps lower your uric acid levels further, reduces the burden on your kidneys, promotes overall health, but for many, it won't be enough on its own to get below that critical 6 milli-GDL target. Now let's talk about the foods that are high in purines and should be limited or avoided.
Let's name names. What are the highest risk foods, the ones to really watch out for?
The top culprits, the ones highest in purines, are red meat and organ meats. This category includes beef, lamb, and pork.
Okay, red meats.
And organ meats are particularly high and should ideally be avoided altogether, things like liver, kidneys, sweetbreads, and brain. These can contain purine levels in the range of 100 to over 200 milligrams per 100 grams serving. That's a significant load.
Wow. Avoid the organ meats. And what about seafood? That's often mentioned as problematic too.
Seafood is definitely a key area, but it's important to be nuanced here. There's a high-risk category of seafood that is very high in purines and should be completely avoided or strictly limited. This includes small oily fish like sardines and anchovies, as well as mussels.
Sardines, anchovies, mussels avoid.
And shellfish like shrimp, lobster, and scallops also fall into this higher risk group.
Shrimp and lobster too. Oh.
Yeah, unfortunately. However, not all fish are in the high-risk category. Some fish, such as tuna and salmon, contain moderate amounts of purines.
Oh, good. Tuna and salmon are okay.
They can be included in a gout-friendly diet in moderation. The typical recommendation is to limit consumption of these to about 4 to 6 ounces per day. So you don't have to give up all fish, just be selective and mindful of portion size.
That's a relief. Some fish is okay in moderation. What about beverages? Are there specific drinks to watch out for?
Yes, this is another critical area where dietary changes can make a big difference. Certain beverages are particularly problematic for gout. Beer is high on this list.
Beer, yeah. Always hear about beer and gout.
It contains significant amounts of purines and is metabolized in a way that increases uric acid production. But perhaps even more impactful in recent years is the recognition of the negative effect of sugary drinks, especially those sweetened with high fructose corn syrup.
Sugary sodas and things.
Exactly. Many sodas and some fruit juices with added sugars fall into this category.
Why are sugary drinks so bad for gout? It's not purines, is it?
Well, high fructose corn syrup has a kind of double whammy effect.
Hmm.
It does contain some purines itself, but more importantly, it's metabolized in a way that actively stimulates the production of uric acid in the body.
Oh, wow. So it actually tells your body to make more uric acid?
Essentially, yes.
Yeah.
So eliminating or drastically reducing beer and beverages with high fructose corn syrup is a really powerful dietary step you can take.
Okay, so avoid organ meats, limit red meat, avoid sardines, anchovies, mussel, shellfish, limit other fish, definitely avoid beer and sugary drinks.
Got it.
Now, for the much more positive side, what can you eat? What food should you be encouraging daily? Let's hear the good news.
The good news is there is a vast and delicious array of gout-friendly foods. For protein sources that are low in purines and even beneficial, low-fat dairy products like milk, yogurt, and cheese are excellent choices.
Dairy is good.
Yes. Studies have actually shown that consuming low-fat dairy provides a protective benefit against gout flares.
That's fantastic.
Eggs are another fantastic low-purine protein option. You can also include moderate amounts of lean poultry like chicken and turkey.
Okay, low-fat dairy, eggs, chicken, turkey. That already sounds like a much more flexible and enjoyable diet than the stereotype suggests.
Absolutely. And it gets even better. Most vegetables are completely fine and should be encouraged as part of a healthy diet.
Even the ones people used to worry about, like spinach or asparagus?
Yes. There was an older belief that some vegetables were high in purines and should be avoided, but modern research has largely debunked this. The purines in vegetables do not significantly impact uric acid levels or gout risk in the same way purines from animal sources or sugary drinks do.
That's huge. So load up on veggies.
Absolutely. Feel free to load up on all your favorite vegetables. Whole grains, rice, pasta, and bread are also generally low in purines and should be part of your diet. And fruits are wonderful, especially certain ones.
I think I know where you're going with this. Cherries.
You got it. Cherries are truly nature's gout fighter. There's compelling evidence that incorporating cherries into your diet can significantly help.
How much do they help?
Studies show that consuming just 1 to 2 cups of cherries daily, whether they are sweet or tart, fresh, frozen, or even as juice concentrate, may reduce the risk of gout flares by up to 35%.
35%. Just from cherries. That's amazing.
It's a simple, delicious, and scientifically supported addition to your gout management strategy.
A delicious and effective strategy. And I hear hydration is another simple but hugely important factor. It keeps coming up.
Hydration is absolutely essential. It's a daily defense strategy against uric acid buildup. Drinking enough fluids, particularly water, helps your kidneys function optimally and assists them in flushing excess uric acid out of your body.
Makes sense. How much water should someone aim for? What's the target?
A good general target is to aim for 8 to 12 glasses of water per day, which is roughly equivalent to 64 to 96 ounces.
8 to 12 glasses. Okay.
And you definitely need to increase this amount if you are in a hot environment, engaging in physical activity, or if you're feeling unwell.
Right. Need more if you're sweating more.
Exactly. A simple, practical way to monitor your hydration level throughout the day is to check the color of your urine. Ideally, you want it to be a pale yellow color. If it's consistently dark yellow, you likely need to increase your fluid intake.
The pale yellow test. Good tip. Are there other drinks that are okay or even beneficial for hydration besides just water?
Yes. Besides water, other beverages can contribute. Coffee consumption has actually been associated with a lower risk of gout in some studies, showing a mild protective effect.
Coffee might help. That's surprising.
It seems so, mildly.
Yeah.
Tea is also a fine choice for hydration and doesn't contribute to uric acid levels in a negative way. So while water is your primary tool, coffee and tea can certainly be part of the mix.
Okay, so we've covered the medical foundation with ULT, the crucial role of diet, which is not bland, and hydration. Beyond that, what other lifestyle modifications are key for preventing flares and managing gout long term?
Weight management is a truly critical component, second only perhaps to medication for many people. Maintaining a healthy body weight significantly impacts your serum uric acid levels and dramatically reduces your overall risk of gout flares.
How exactly does weight affect uric acid? Why does losing weight help?
Well, excess body weight can increase the production of uric acid,
Hmm.
and importantly, it can also impair the ability of your kidneys to effectively excrete uric acid.
Ah, so it's both making more and getting rid of less.
Correct. So losing weight if you are overweight can directly help lower your uric acid levels and reduce the burden on your body's systems that handle uric acid.
What's the best way to approach weight loss when you have gout? Are there things to avoid? Because I feel like crash diets might be bad.
You're absolutely right to be cautious. The key is to aim for gradual, sustainable weight loss. A healthy goal is typically 1 to 2 pounds per week. The aim is to reach and maintain a healthy body mass index, BMI, generally considered between 18.5 and 24.9.
Slow and steady.
Exactly. And this is extremely important. You must avoid crash diets, very low-calorie diets, or prolonged fasting. While rapid weight loss might seem appealing, it can actually have the opposite effect in the short term. It can trigger acute gout flares.
Wow. Why does rapid weight loss trigger flares?
It's because the rapid breakdown of tissues, including fat, can cause a temporary spike in uric acid levels. So slow and steady definitely wins the race when it comes to weight loss and gout.
That's a really vital warning. Fast weight loss can actually provoke a flare. What about exercise? How does physical activity fit into gout management?
Regular physical activity is highly beneficial. It helps reduce systemic inflammation throughout the body, supports healthy weight management, and improves overall joint health. The general guideline is to aim for at least 150 minutes of moderate intensity physical activity per week.
150 minutes a week. What kind of exercise is recommended, especially considering that joints might be sensitive or prone to flares? You don't want to pound on sore joints.
Absolutely not. Low-impact options are excellent choices for people with gout, as they provide cardiovascular and muscular benefits without putting excessive stress on potentially vulnerable joints.
Like what?
Activities like walking, swimming, cycling, and yoga are all highly recommended. The key is to find activities you enjoy and can incorporate consistently into your routine.
Find something you like and stick with it.
Exactly. Now, it's important to note that during an acute gout flare, you should rest the affected joint to minimize pain and inflammation.
Rest the hot joint.
Yes. However, if other joints are unaffected and you feel up to it, you can maintain gentle movement or light activity elsewhere in your body, like gentle stretching or upper body exercises, to stay active within your comfort level. The focus during a flare is rest for the affected joint, but staying generally active between flares is very beneficial.
That's a helpful distinction. Rest the hot joint, but stay active elsewhere or when you're in remission. Now, let's talk about the moment a flare strikes. You mentioned timeliness is crucial for colchicine, but what's the immediate emergency action plan the moment you feel that familiar twinge of pain starting? What do you do right then?
Speed is absolutely of the essence when a flare begins to minimize its severity and duration. Think of these steps as your immediate response plan. Step 1, and arguably the most crucial, is to start taking your prescribed anti-inflammatory medication immediately.
Don't wait.
Don't wait to see if it gets worse. The sooner you treat it, the better.
Okay, meds first. What other immediate steps should you take?
Rest and elevate the affected joint. Get off your feet if the flare is in your foot or ankle. Elevating the limb above heart level can help reduce swelling.
Rest, ice, compression, elevation, or just rest and elevate.
Rest and elevate are key. Applying ice packs is also great. Apply ice to the affected joint typically for 20 minutes on, followed by 20 minutes off can provide significant pain and swelling relief.
Ice, 20 on, 20 off. Got it.
And as we discussed regarding daily hydration, you should also significantly increase your water intake during a flare. This helps support your kidneys in flushing uric acid. And, importantly, be extra vigilant about strictly avoiding all known trigger foods and beverages during the flare.
Okay, so meds, rest, elevate, ice, water, avoid triggers. That's the plan. What are the medication options for treating the acute flare itself, separate from the long-term ULT like allopurinol?
Right. For the acute pain and inflammation of a flare, the primary options are NSAIDs, non-steroidal anti-inflammatory drugs like ibuprofen or naproxen.
Like Advil or Aleve.
Exactly. These are very effective at reducing pain and swelling, but they should only be used if you don't have underlying health conditions like significant kidney disease or heart problems that would make them unsafe. Always check with your doctor.
Good caveat. What else?
Colchicine, as we mentioned, is also a powerful anti-inflammatory for acute flares. But again, it must be started very early in the attack, ideally within hours of onset, to be most effective.
And the third option?
Corticosteroids, such as prednisone pills, or a corticosteroid injection directly into the affected joint by a doctor, are another option. These are particularly useful for patients who can't tolerate NSAIDs or colchicine.
Okay, so NSAIDs, colchicine if early, or steroids. And just to reinforce that crucial point one more time about continuing ULT during the flare.
Absolutely. It's worth repeating because it's such a change in past practice and so vital for long-term success. While you're taking NSAIDs, colchicine, or corticosteroids to treat the pain and inflammation of the acute flare, you must continue taking your prescribed urate-lowering therapy, or allopurinol or febuxostat, exactly as you normally would. Do not stop it.
Got it. Don't stop the allopurinol.
Treating the acute pain and managing the underlying high uric acid are two separate but simultaneous goals during a flare.
That distinction is incredibly important for effective management. So we've laid out the landscape, understanding gout, the modern treatment essentials with medication, diet, lifestyle, and managing flares. How do you know if all these pieces are actually working together? How do you monitor your progress and track success?
Regular monitoring is absolutely essential. It's how you and your healthcare provider ensure that your treatment plan is on track, that you are reaching your uric acid target, and that your lifestyle changes are having the desired impact. It takes the guesswork out of management.
What kind of monitoring is involved? What should people expect?
Essential blood tests are the cornerstone of monitoring, particularly your serum uric acid level. When you first start ULT and are adjusting the dose, you'll likely need monthly uric acid tests.
Monthly at first.
Yes, until your level consistently hits that target below 6 mg/dL, or 5 mg/dL if you have tophi. Once your uric acid is stable and at target, the frequency of testing can usually be reduced to every 3 to 6 months.
Okay, monthly then, maybe twice a year or so.
Right. That consistency at the target level is key, because that's when crystal dissolution really happens. Additionally, because kidney health is so closely tied to uric acid excretion and medication processing, your kidney function.
Need to check the kidneys, too.
Yes. Measured by tests like serum creatinine and estimated glomerular filtration rate, or eGFR, that should typically be monitored every 6 months while you're on ULT. Liver function tests might also be done as clinically indicated.
So blood tests confirm the medication is doing its job and checking related systems like kidneys. What about tracking things day to day outside of the doctor's office? Things you can do yourself.
Lifestyle tracking is incredibly valuable. It puts the power of information in your hands. Documenting your symptoms is key, tracking the frequency of flares, for example. The ultimate goal really is 0 attacks after about 6 months of consistent ULT and reaching your target uric acid level.
0 attacks is the goal.
That's the aim. You can also note the severity of any attacks using a simple 1 to 10 pain scale, which can help you see if even infrequent flares are becoming less intense over time.
Good idea.
And keeping a diary of your food intake, alcohol consumption, and physical activity can be very helpful for identifying your personal flare triggers.
Like noticing a pattern between, say, having shrimp scampi one night and a flare the next day.
Exactly. It helps you learn your body's specific reactions. Tracking daily metrics like your weight, perhaps weekly, ensuring you're meeting your daily water intake goal, and simply confirming that you're taking your medication consistently each day are all forms of monitoring your adherence and progress.
It makes you more aware.
Absolutely. All this tracking isn't just busy work. It provides real insights. It helps you understand your personal triggers, allows you to see tangible evidence of how diet, hydration, and exercise impact your well-being, and confirms that your medication is effectively controlling your uric acid. This empowers you to make informed decisions and adjustments with your doctor.
That proactive approach, combining clinical tests with personal tracking, sounds much more effective than just waiting for the next flare. Now, as people start this journey of taking control, what are some of the most common mistakes beginners make that they should really try to avoid? The pitfalls.
It's definitely helpful to know the common pitfalls so you can steer clear of them. One of the most frequent and detrimental mistakes, as we've hammered home, is stopping urate-lowering therapy, like allopurinol or febuxostat, during a flare.
Still #1 mistake.
It really is a major step backward in long-term management. Inconsistent daily dosing of ULT is another error. It needs to be taken reliably every day to maintain stable, low uric acid levels.
Consistency again?
Yes. Some people might also skip the colchicine prophylaxis when they start ULT, perhaps due to fear of side effects. thereby missing that protective step that helps prevent initial flares. And a very common mistake is discontinuing treatment altogether when you haven't had a flare in a while and start feeling good.
The "I feel better, so I must be cured" mistake. Why is stopping treatment when you feel better so risky?
Because feeling better usually means your uric acid level has dropped enough to stop triggering acute attacks, but it doesn't necessarily mean all the existing crystals have dissolved or that your level is low enough to prevent future problems long term.
Right, the crystals might still be there.
Exactly. Stopping treatment allows your uric acid levels to rise again, almost guaranteeing future flares and risking that irreversible joint damage down the road. It's essential to stay on ULT consistently, typically for life for many people, to keep the uric acid low and prevent crystals from forming or reforming.
That makes perfect sense. Feeling better means the treatment is working, not that you don't need it anymore. What about common dietary mistakes?
Believing that diet alone is sufficient to cure or control gout is a significant misconception for most people. While diet is incredibly important support, in the majority of cases with clinically significant hyperuricemia or established gout, medication is necessary to reach and maintain that required low uric acid target.
Diet helps, but usually isn't enough alone.
Right. Another mistake is unnecessarily eliminating all foods that contain any purines. It's about moderation and focusing on the highest risk foods, not total restriction, which isn't sustainable or necessary. Inadequate hydration is another frequent pitfall.
Not drinking enough water.
Exactly. Underestimating how critical water is for uric acid excretion. And unfortunately, returning to old eating habits that contributed to high uric acid levels too quickly after starting treatment is a common setback. Slipping back into old patterns.
Any other lifestyle pitfalls people should be mindful of?
Yes, beyond diet and medication, attempting that rapid weight loss is counterproductive due to the flare risk we discussed. Underestimating the impact of alcohol, particularly beer and hard liquor, is another issue. Even moderate consumption can trigger flares in some individuals.
Alcohol is a big trigger for many.
It often is. Remaining sedentary between flares doesn't support overall health or weight management, which are beneficial. And while it might seem less direct, ignoring stress management can also contribute to overall inflammation in the body, which isn't helpful for an inflammatory condition like gout.
Stress impacts everything, doesn't it?
It really can.
These are all valuable points to consider as you navigate living with gout. With all these strategies, when is it appropriate or necessary to seek the expertise of a specialist, like a rheumatologist? When do you need more than your primary care doc?
There are several clear indicators that suggest a referral to a rheumatologist. A doctor specializing in arthritis and musculoskeletal diseases is warranted. If you are experiencing frequent attacks, typically defined as more than 2 per year, despite being on treatment.
More than 2 flares a year means see a specialist.
It's a strong indication that your gout isn't adequately controlled, yes. Also, if multiple joints are affected simultaneously during flares, that's another sign of more widespread disease that might benefit from specialist management.
Okay.
The development of tophi, those visible crystal deposits we talked about, is a strong indicator that your gout is progressive and may require more aggressive or complex treatment approaches that a specialist is best equipped to handle.
Tophi definitely means specialist.
Generally, yes. If you have a history of kidney stones, which can be related to high uric acid, that's another reason to consult a specialist.
What if someone is following their treatment plan, but their uric acid levels just aren't hitting that target? They're stuck above 6.
That's a key reason for referral. If you're having difficulty reaching the target uric acid level of below 6 mg/dL or 5 mg/dL, despite being on a standard dose of ULT or trying different standard medications, a rheumatologist can explore alternative medications, combination therapies, or those more advanced treatment options we touched on earlier.
When standard treatments aren't enough.
Right. Also, if you experience significant or debilitating side effects from your gout medication that make it difficult to stay on treatment, a specialist can help find a more suitable approach.
So a specialist is for when the gout is more complex, aggressive, hard to control, or treatment is causing problems. Looking ahead, what does the future hold for gout treatment in 2025 and beyond? Is there reason for optimism? Should people feel hopeful?
Absolutely. There is significant reason for optimism. The field is advancing, and our understanding of gout is improving all the time. We're seeing continued development and availability of advanced therapies for those treatment-resistant cases.
Like the IV drug, pegloticase.
Exactly. And newer combination medications that help the kidneys excrete more uric acid. And areas like the potential dual benefit medications like the SGLT2 inhibitors for patients with comorbidities.
The diabetes drugs that might help gout, too.
Right. And the exploration of the gut microbiome's role, the probiotic therapy research, represent exciting new avenues. There's a lot happening.
More options for tough cases and exploring the body in new ways.
Precisely. And there's a growing emphasis on personalized medicine. The trend in 2025 is increasingly towards tailoring treatment, specifically to the individual.
What does that mean, personalized medicine for gout?
It means considering factors like your genetic profile, optimizing your kidney function, comprehensively managing any other health conditions you have alongside gout, like high blood pressure or diabetes, and importantly, incorporating your lifestyle and preferences into the treatment plan. It's moving towards a truly individualized approach to help you achieve control, not just following a one-size-fits-all protocol.
That sounds like a much more empowering approach for the patient, more tailored. To make all this actionable, the information we've looked at outlines a kind of 30-day quick start plan. Can you walk us through that briefly as a potential starting point for someone listening?
Yes, it's a great way to break down the initial steps into manageable weekly focuses. Week 1 is all about foundation setting.
Laying the groundwork.
Exactly. This involves getting those initial blood tests done, uric acid, kidney function, etc. Start a detailed diary to track your symptoms, any pain, swelling, your food and drink intake, and your activity levels. Begin tracking your daily hydration. And if you think you might need a specialist based on your history, this is a good time to research rheumatologists in your area.
So, getting your baseline data and setting up your personal tracking system makes sense. Week 2.
Week 2 is treatment initiation. This is likely when you'll start your prescribed urate-lowering therapy, like allopurinol, and begin the recommended colchicine prophylaxis to help prevent initial flares. Pay close attention to any side effects and communicate them to your doctor. Begin implementing the gradual dietary modifications we discussed, focusing on reducing high-purine foods and increasing beneficial ones, and establish a routine for gentle, low-impact exercise.
Okay, putting the medical and lifestyle plan into action. What about week 3?
Week 3 is habit development. This is about building consistency. Make taking your medication a daily routine, set reminders if needed. Fine-tune your diet based on the insights you're gaining from your diary, what feels good, what might be a trigger. Gradually increase your water intake towards your goal. And maybe start incorporating stress management techniques like deep breathing or meditation, which can also be helpful.
Making those new behaviors stick. And the final week? Week 4.
Week 4 is progress assessment. This involves getting your first follow-up blood tests, usually about a month after starting ULT, to see how your uric acid levels are responding. Review your symptom and lifestyle diary with your healthcare provider. Based on your blood results and your tracking information, your doctor can make any necessary adjustments to your medication dose or fine-tune your overall plan. This sets the stage for your long-term management strategy.
That structured approach foundation, initiation, habit, assessment really does make it feel much more achievable, breaking it down like that. So as we wrap up this deep dive into gout management for 2025, what are the absolute must-remember key takeaways, the essential points for listeners to carry with them?
Okay, the big ones. First and foremost, and this is the most important message, gout is highly treatable. A life free from debilitating flares and constant pain is absolutely possible with proper management.
That's the hope right there.
It really is. Secondly, for most people, medication, specifically urate-lowering therapy, is not optional. It is necessary for long-term control, dissolving crystals, and preventing progression and irreversible joint damage.
Medication is usually essential.
Yes. While diet and lifestyle changes are crucial support, they really do help. They typically cannot replace the need for medication to reach and stay at that critical low uric acid target in most cases.
Diet supports doesn't replace.
Generally, yes. Consistency is paramount. Consistency in taking your medication exactly as prescribed, consistency in your hydration, and consistency in making healthy lifestyle choices.
Consistency, consistency, consistency.
It's key. Starting treatment early is vital. It prevents the development of chronic pain, joint deformity, and mobility loss that characterize advanced gout. Don't wait.
Early treatment prevents damage.
Right. Regular monitoring of your uric acid levels is non-negotiable for ensuring your treatment is effective and keeping you on track. You have to know your numbers.
Know your numbers.
And finally, remember that building these sustainable habits takes time and patience. This is a journey, not a quick fix. Progress happens step by step. Be persistent and celebrate the small victories along the way.
Those points collectively offer such a powerful message of hope and action. It really underscores that you don't have to accept living with the limitations and pain gout can impose. Taking control is achievable with the right knowledge and consistent action.
Exactly. It requires a multifaceted approach, leveraging the power of modern medication alongside smart, sustainable diet and lifestyle choices. The landscape of gout management in 2025 offers more effective strategies and better outcomes than ever before, truly enabling you to move towards improved mobility and a life with significantly less pain or even no pain.
This deep dive has covered so much, from the fundamental science of gout, the why, to practical week-by-week steps you can start taking right away. The how.
We truly hope this helps you feel significantly more informed and empowered on your journey to manage gout effectively. Remember, every step you take in applying these strategies is a step towards long-term success and a pain-free future. And remember, the power of community, connecting with the Gout Gourmet community or other support groups, can provide valuable encouragement and shared experience. You're not alone in this.
Thank you so much for joining us for this deep dive into taking control of gout. We encourage you to start implementing the strategies we've discussed and take that first crucial step towards a life with less pain and greater freedom of movement.
If you found this deep dive helpful, please subscribe to Gout Gourmet so you don't miss future episodes, where we continue to explore complex topics and deliver the actionable insights you need. And definitely come back next week for more.
Until then,
Your journey to pain-free living begins now.